Hi, I'm Wyatt Hall. I work at the UMass Department of Psychiatry. I have a PhD in clinical psychology, and I specialize in working with the deaf. I do assessments, one-on-one therapy sessions, and give lectures. The goal of today's video is to provide you with some tips and tricks on what to do if a deaf individual visits your clinic, hospital, or emergency room. Hi, my name is John Lastina, Jr. I am an interpreter here at UMass. I have been certified for just over 1 year, and I have been signing my whole life. My parents are deaf, and I am a CODA. Today, I will be discussing how to find an interpreter and how to work with them. This training is designed for behavioral health providers, front desk staff, and people who work in emergency settings. The individuals who come in seeking care typically represent a diverse population of backgrounds, language, disability, education, etc. It is up to us to accommodate the individuals who come in. Today's purpose is to make sure we improve your skills accommodating deaf patients. We do this by focusing on how to provide appropriate communication services and making sure they are welcomed in a deaf-friendly way. The deaf community is a socio-linguistic minority, and they typically identify themselves as deaf with a capital D, meaning they consider themselves part of a culture, with the foundation being ASL, or American Sign Language. They also prefer not to be labeled as hearing impaired. Hearing impaired is considered an insulting term. The general hearing population sees the label as politically correct, while deaf individuals do not like the term. The deaf community is more similar to a community of Native Americans or a community of Jewish Yiddish speakers, as is seen in New York City, similar in that they are minorities with their own language. ASL has been proven through much research to be a unique language with its own grammar, structure, rules, and syntax. It is an authentic language. It is not simply signing in English or gesturing. ASL is a complex visual language. If a deaf individual comes in, do not stress. It is important to stay calm, take your time, and maintain eye contact while following their preferred style of communication. Perhaps the deaf individual prefers to write back and forth. They may also need a sign language interpreter, and they may even speak for themselves. Deaf individuals are the expert on their preferred communication style, and it is important to follow their lead. If you keep an open mind, maintain a steady pace, and are flexible, the interaction with the deaf individual will go smoothly. It's important to remember that if a deaf individual needs a sign language interpreter, you have a legal responsibility to provide the interpreter under the Americans with Disabilities Act, or ADA. Also, if you are under the Joint Commission, you have a responsibility to provide communication access. Now that you have successfully acquired an interpreter, it is important to be aware of how to use one. First, it is important to remember that the interpreter's role is to interpret between the deaf individual and the medical professional across any language or cultural barriers. Sometimes it can be tempting to use the interpreter as a messenger. You may be busy running around the floor and ask the interpreter to go tell the patient something, then leave. You can't do that. An interpreter that willingly takes the role of a messenger is violating the CPC, or Code of Professional Conduct, and it is not appropriate to ask one to do so. The interpreter is not a doctor or a nurse and does not have specialized knowledge. It is important that the deaf patient has full access to their care. The interpreter will accompany you and interpret for you in the moment. While using an interpreter, remember to speak directly to your deaf patient. Do not speak to the interpreter. Speak and make eye contact with your deaf patient. And do not use phrases like tell him or her this or ask the patient that. It is important that you address your patient directly. Eye contact is highly valued in the deaf community. If you are looking at the interpreter, it is considered rude. Also, it is important to make time for the interaction. Don't speak too fast and don't slow down your speech. Just use a normal speech pattern. Give time for the interpreting process as well as for understanding to occur. Making time for the interaction does not mean speaking slowly. It means to make sure understanding is occurring and to take your time. If paperwork is involved, be sure to give the deaf individual time to watch the interpreter, then to focus on the paperwork. They cannot focus on both at the same time. Any details like names or numbers need to be spelled out and possibly repeated during the interpreting process. It is easy to be unaware of this while you're speaking, but the interpretation may be falling behind. It's important to take your time. The presence of an interpreter does not ensure that your deaf patient will understand what you're telling them. It is your responsibility to make sure your patient is understanding your message. So how do you check for understanding? You could ask the patient to repeat what you just said, and you can watch their facial expressions. If they are understanding, they may be nodding along, or if they're confused, they may show it in their expression. If there is no interpreter, that's fine. You can use gestures or point. If you're helping with paperwork, you can point at the paper or point to various signs that may be posted around the room. Do not assume that writing back and forth will always be successful. Not all deaf people are bilingual, using ASL as well as written English. Try your best to interact, and if they prefer to write, then use that approach. If not, try to find another way to interact. When the time comes to find a sign language interpreter, it is best to follow whatever internal processes have been put into place by your agency or hospital. If there are no internal processes, you will need to use your local resources. Here in Massachusetts, there are 3 standard options. First is MCDHH, Massachusetts Commission for the Deaf and Hard of Hearing. Second is private interpreting agencies, and you can also choose freelance interpreters. Typically, the best approach is to develop your own interpreting department, with interpreters on staff who are qualified to work in medical settings. This approach works best for large hospitals who serve a large deaf population. That option, if available to you, is the best one. Developing an internal interpreting department is not always realistic, especially for smaller hospitals or hospitals that do not serve large deaf populations. If that is the case for you, there are other options. MCDHH is a state agency that provides a variety of services to the deaf community. They also provide an interpreter referral service. That is a good option for developing your own pool of local freelance interpreters. MCDHH does not charge for this referral service, and they do not provide the interpreters directly. They act as a liaison between interpreters and those that need interpreting services. Another approach to developing your own pool of interpreters is to access the Registry of Interpreters for the Deaf, or RID. RID is the national certifying organization for interpreters all over America, and they maintain a database of all certified interpreters by state. The advantage of using RID's database is you can contact interpreters directly and negotiate rates that meet your organizational needs. It all depends on if your organization is structured to negotiate with multiple interpreters. Using private agencies is another good option. They can provide interpreters at a flat rate and on a consistent basis. However, private agencies can be more expensive than dealing with multiple freelance interpreters. Again, it all depends on your organization. Are you structured to deal with multiple freelance interpreters, or would it be advantageous to pay an agency to handle the logistics? So how do you choose the right interpreter? You have now decided how to acquire an interpreter, but how do you know if they are the right fit? Interpreters have a variety of backgrounds, skills, and qualifications. Some specialize in legal, medical, mental health, etc. It is important to choose a medically qualified interpreter. The most important qualification is that the interpreter fits the deaf person. All interpreters have different signing styles, just like deaf people all have individual signing styles and preferences. The best approach to finding an interpreter that is qualified and the best fit is to ask the deaf individual if they have any preferred interpreters. Remember, the deaf individual is the expert on their communication style and preferences. Some deaf individuals may request a CDI. A CDI is a certified deaf interpreter. A CDI can be very helpful to the situation. They work as a team with the ASL interpreter. The interaction takes place like this. The doctor will speak, the ASL interpreter who is hearing will interpret into ASL, the CDI watches the ASL interpreter and presents the information to the deaf patient in more clear ASL, giving the deaf patient a much clearer understanding. It is also important to mention, do not use the deaf patient's friends or family to interpret any information. Using friends or family brings up many layers of legal, ethical, and confidentiality issues. For example, if you use the deaf patient's child, the child may have to tell their parent that they have a serious illness. Emotions are involved, and the message may not be interpreted clearly. Do not do this. Here's a brief summary of what you've just watched. First, remember to engage in a deaf-friendly manner. Remember that each deaf individual is different, and what works for one may not work for another. Also, the deaf community considers themselves a sociolinguistic minority. They do not consider themselves handicapped, and they may become offended if you use labels like hearing impaired. Make sure you are familiar with your organization's process for acquiring interpreters. There are multiple options you can choose from for this. And most importantly, remember that the deaf individual is the expert on their communication style. Follow their preferences, and the interaction will be much simpler for the patient and for you.